bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
How do New Jersey's Medicaid costs compare to other states? Hello and thanks for joining us. I'm Jill Horner. This hour's newsmaker is Michael Rickards, Executive Director of the Hall Institute of Public Policy, New Jersey. Today we're talking about Medicaid costs and how New Jersey compares to the rest of the country. Thanks for being with us.
Thank you for having me.
First of all, explain to us a little bit about the Hall Institute and your role in public policy.
Well, the Hall Institute is a new public policy center. We're nonpartisan. We're not for profit. We were founded by a philanthropist named George Hall. And our purpose is to really put forward, first on our website and then elsewhere, the types of papers, the type of op-ed pieces that we're going to be looking at, and then also solutions to the major problems that the state faces.
One of those problems is Medicaid. When we talk about federal cuts, what does that mean in terms of those New Jerseyans that are dependent on Medicaid?
Well, I think it means that Medicaid, which really covers poor people, is a federal program which is heavily dependent, though, on the states. It's a joint program between the states and the federal government, and we've had a special report commissioned by Professor Glidd of Columbia University School of Public Health, which really examines the whole Medicaid question and compares New Jersey to other states in the Union.
How does New Jersey stack up?
Well, we stack up fairly well in terms of coverage. But this is a very expensive state, as you know, compared to other states. The cost of living is very, very high. And so we're going to find that as the federal government decides to eliminate aspects of eligibility, that New Jersey is going to be faced with a terrible choice, which is to either go along or to come up with the money to cover what used to be federal areas that they were covering.
When we talk about these tough financial times in this state and a large state debt, how does New Jersey come up with the funds in order to make up that shortfall from the federal government for Medicaid?
Well, I think this is going to be very difficult. Even changes, for example, in the prescription drug benefits have caused havoc throughout the United States, and the state itself has said, gee, the federal government should be giving us some money to allow us to carry over some of the programs that we had. And so I think it's going to be a major priority. Medicaid, in many ways, is a problem that is much more serious than the Social Security system, which is in fairly good shape compared to Medicaid.
Moving forward, what does it mean for these low-income seniors and families and children dependent on this coverage?
Well, New Jersey has got a problem very similar to the rest of the country. We are the only industrialized nation on the face of the earth that doesn't have national medical coverage. We have a kind of a very strange mix of state programs, federal programs. Many of us are privately insured. We're lucky. It's the 40 million people throughout the country who are not insured and who are thrown onto Medicaid, thrown onto what amounts to, in some other cases, the public charities that are so helpful. But it's not a situation, it seems to me, that's going to get any better without a major change in our national priorities.
So moving forward, what steps need to be taken in order for state governments, not just New Jersey, but all states, to work with the federal government in order to find some sort of resolution?
Well, right now, instead of looking at how to solve the problem, looking at how to cut the programs and how to cut eligibility, and the National Governors Association put forth a series of proposals which mirror what the administration wants to do, and I think that's, in the long term, a mistake. What has to be done, and I imagine the initiative isn't going to come from the states, but actually going to come from the business community. And that is, they're going to decide, really, these are too expensive, these programs. The pension programs, as you've seen, are too expensive for major corporations, let alone small businesses. And I think there's going to be a push throughout the country for a national system that allows coverage to everyone. Right now, we pay an enormous amount of money in overhead because we don't have one program. Unlike Social Security, which is a very cheap program to run, Medicare and Medicaid are rather expensive programs to run.
All right, thank you so much. Come back and give us an update and let us know how this evolves.
Good, thank you.
Thanks for watching. We've been talking with Michael Rickards, Executive Director of the Hall Institute of Public Policy, New Jersey. I'm Jill Horner.